Concept 46, Collaboration, Concepts. Learning objectives. Define and describe the concept. Recognize attributes of collaboration in the nursing profession. Identify ways that collaboration impacts healthcare. The word collaborate is derived from Latin word collaborare, meaning to labor together. Collaboration usually has the connotation of working with others in an intellectual endeavor. Nurses labor with patients, families, and healthcare workers such as physicians, pharmacists, social workers, physical therapists, medical assistants, and other lay health workers using knowledge, reasoning, and critical thinking skills to promote or restore health. For the purposes of this concept presentation, collaboration in nursing is the development of partnerships to achieve best possible outcomes that reflect the particular needs of the patient, family, or community, requiring an understanding of what others have to offer. Collaboration also involves a joint responsibility for patient outcomes. Scope and categories. The scope of collaboration spans 4 overarching categories, each based on collaboration with the nurse, nurse-patient, nurse-nurse, interprofessional, and interorganizational collaboration. See Figure 46.1 on page 439 in Concepts. Scope. The scope of collaboration spans 4 overarching categories. The first is nurse-patient collaboration. Nurses are inherent collaborators. The American Nurses Association identifies 6 standards for nursing practice known as the nursing process: assessment, diagnosis, outcomes identification, planning, implementation, and evaluation. Opportunity for nurse-patient collaboration exists at each level of the process. Nurses particularly collaborate with patients as fully functional members of the healthcare team in making healthcare decisions. For example, nurses collaborate with patients regarding health promotion and disease prevention behaviors, treatment strategies and options, lifestyle changes, and end-of-life decision-making. The historical context for nurse-patient collaboration is rich and extensive. Florence Nightingale encouraged collaboration with the patient, assessing what is needed or wanted. In an early use of nurse-patient collaboration, Hildegard Peplau described a component of the working phase of her nursing theory as the patient participating with and being interdependent with the nurse. Also in her human-to-human relationship model of nursing, Joyce Travelby defined nursing as an interpersonal process whereby the nurse assists an individual, family, or community to prevent or cope with the experience of illness and suffering, and if needed, to find meaning in these experiences. Throughout the years, many other nurse theorists have examined and defined the nurse-patient relationship, with elements of nurse-patient collaboration existing in many of the theories. Nurse-nurse collaboration. Nurse-nurse collaboration or intra-professional collaboration is also important to consider. How do nurses collaborate together? Nurses develop nursing teams on hospital units, in clinics, and in community settings that provide collaboration and support in patient caregiving. Nurses from various specialty areas also collaborate: nurse managers, nurse researchers, nurse educators, advanced practice nurses, as well as novice nurses with expert nurses. Mentoring. Mentoring is a special type of collaboration or a creative partnership, typically between a novice nurse and an expert nurse that has been recognized as beneficial to the development of professional nurses. Mentoring is described as purposeful activities that facilitate the career development, personal growth, caring, empowerment, and nurturance that are important to nursing practice and leadership. The purpose of mentoring is to enable a smooth transition from novice nurse to a knowledgeable practitioner who is self-reflective and self-confident and who is able to negotiate both professional and patient relationships. Despite the valuable benefits of mentoring, challenges to successful and constructive mentorships exist. Kitola stated that mentoring needs to go beyond the acquisition of knowledge and skills and include the socialization of a nurse transmitting the norms, values, and accepted modes of behavior for the professional nurse. Jakubik also encouraged mentoring to progress from the traditional approach of fostering support, competency, and job retention to a more modern approach of promoting career development and advancement, similar to mentoring in the business world. Shared governance. Shared governance is another type of collaboration found in nursing. Shared governance is a nursing practice model that fosters a decentralized style of management that creates an environment of empowerment. Shared governance is seen as an important component of professional practice and pursuit of magnet designation from the American Nurses Credentialing Center. The goal of shared governance is to transition from a traditional hierarchical management style to one in which nursing staff are more involved in decision-making processes and managers are facilitative rather than controlling. Nurses practicing in a shared governance environment truly labor together and collectively develop collaborative relationships. Collaborating in the shared governance model, nurses can help to improve quality of care and clinical effectiveness, facilitate the development of knowledge and skills, and increase professionalism and accountability. Shared decision-making, the cornerstone of shared governance, is an essential element to improve the healthcare system of the future. Interprofessional collaboration. The true essence of collaboration involves working across professional roles. With interprofessional collaboration, individual areas of expertise are represented, along with diverse perspectives influenced by professional orientation, experience, age, gender, education, and socioeconomic status. The goal of interprofessional collaboration is the formation of a partnership between a team of health providers and a patient in a participatory, collaborative, and coordinated approach to share in decision-making of health and social issues. The scope of interprofessional collaboration is vast and could include professionals from nursing, medicine, pharmacy, occupational therapy, physical therapy, dentistry, social work, education, law, or many others interacting with the patient and family. Not surprisingly, different professions perceive collaboration in different ways. For example, nurses typically perceive a greater need for collaboration than do physicians. However, physicians perceive a higher occurrence of collaboration. In a study by Matsu and colleagues, more than 60% of nurses reported that physicians did not collaborate during the therapeutic or decision-making process, nor did they accept nurses' opinions. Contrarily, more than 90% of the physicians in the study stated they respected nurses' work and accepted the nurses' responsibility in patients' care. An important barrier that was identified by the physicians was that they did not recognize the nurse's professional role. Macri and colleagues observed that nurses in the operating room setting described collaboration as shared decision-making, whereas physicians described it as having their needs anticipated and their directions followed. Interprofessional collaboration involves navigating different professional cultures and specialized languages and understanding different viewpoints and goals, including various measures of success. A growing trend in professional healthcare curricula is to offer interprofessional courses as a means of facilitating mutual respect, understanding, and commitment to common goals, joint problem solving, mutual give and take, shared accountability, and collegial communication. Best practices to deliver interprofessional education are being researched and developed. General opinion in interprofessional education is that students benefit from learning to collaborate in an academic setting before they are expected to practice together in a care delivery setting. One study shows little change in medical student attitudes about communication and collaboration before and after interprofessional education experiences compared to nursing student attitudes. However, other studies have shown positive changes in medical students' attitudes toward their nurse colleagues when introduced to the diverse roles on interprofessional teams. Pfaff and colleagues found that new graduate nurses were more confident in interprofessional collaboration if their unit educator and manager had close proximity and were easily accessible. If different health care disciplines were worked with daily and if satisfaction with the team existed. New graduate nurses in acute care settings had more confidence in interprofessional collaboration than did community or long-term care new graduates. Interorganizational collaboration. Consideration of interorganizational collaboration is important in today's healthcare environment. Pooling of resources and information between organizations can benefit patients and communities at regional, national, or international levels. Interorganizational collaboration often takes place in the form of coalitions or consortiums. For example, nurses have been involved in coalitions addressing healthcare disparities, diabetes prevention, teen pregnancy, immunization rates, and healthcare for the homeless. Healthcare consortiums often exist in communities or regions to ensure integrated care delivery, information, and networking among healthcare deliverers. Attributes and criteria. The Interprofessional Education Collaborative Expert Panel, a panel representing the nursing, pharmacy, medical, osteopathic, public health, and dental professions, identified 4 competencies or attributes necessary for effective interprofessional collaboration. These attributes are transferable to intraprofessional collaboration, and they represent the ingredients or attributes needed for successful collaboration. They are 1. Values and ethics, 2. Roles and responsibilities, 3. Communication, and 4. Teamwork and team-based practice. These are further described with several specific competencies mentioned for each attribute. Values and ethics. Values and ethics, ungirded with mutual respect and trust, are an important component in creating a professional and interprofessional identity. These values and ethics are embedded in patient-centeredness and strive for safer, more efficient, and more effective systems of care. Demonstrations of interprofessional values would be evidenced by professionals working together and applying principles of altruism, excellence, caring, ethics, respect, communication, and accountability to achieve high-level health and wellness in individuals and communities. The ethical principles considering healthcare as a right and balance in the distribution of resources are also important. Respect for diversity that is found in the individual expertise each profession contributes to care delivery is also considered. 10 competencies were identified for the attribute of values and ethics. The following 4 are highly pertinent for collaborative practice. Embrace the cultural diversity and individual differences that characterize patients, populations, and the healthcare team. Respect the unique cultures, values, roles, responsibilities, and expertise of other health professionals. Work in cooperation with those who receive care, those who provide care, and others who contribute to or support the delivery of disease prevention and health services. Work in cooperation with those who receive care, those who provide care, and those who contribute to support the delivery of disease prevention and health services. Demonstrate high standards of ethical conduct and quality of care in one's contributions to team-based care. Roles and responsibilities. Collaboration requires an understanding of how professional roles and responsibilities support patient-centered care. Clearly articulating one's professional role and responsibilities to other professions and conversely understanding other professions' roles is a key element for effective collaboration. Recognizing legal boundaries and limits of professional expertise is also needed. Understanding that roles and responsibilities might change based on a specific care situation is important. The following 3 competencies are representative of roles and responsibilities in collaboration. Engage diverse healthcare professionals who complement one's own professional expertise as well as associated resources to develop strategies to meet specific patient care needs. Use the full scope of knowledge, skills, and abilities of available health professionals and healthcare workers to provide care that is safe, timely, efficient, effective, and equitable. Communicate with team members to clarify each member's responsibility in executing components of a treatment plan or public health intervention. Communication has been defined as a core aspect of collaborative practice. Health professionals communicate a readiness to collaborate by being available in place and time, as well as being receptive through displaying interest, engaging in active listening, conveying openness, and being willing to discuss. A common language for team communication that avoids professional jargon is considered a key to safe and effective communication. Dismantling professional hierarchies created by demographic and professional differences is also valued in interprofessional communication. All professions and team members are equally empowered to speak up in firm, respectful ways regarding patient care issues. Finally, consideration of health literacy and effective use of communication technologies are viewed as important components of interprofessional communication. The following three competencies are shared as examples of collaborative communication. Organize and communicate information with patients, families, and healthcare team members in a form that is understandable, avoiding discipline-specific terminology when possible. Listen actively and encourage ideas and opinions of other healthcare team members. Recognize how one's uniqueness, including experience level, expertise, culture, power, and hierarchy within the healthcare team, contributes to effective communication, conflict resolution, and positive interprofessional working relationships. Teams and teamwork. Learning to be a good team player is an important component of collaboration. Teamwork behaviors involve collaboration in the patient-centered delivery of care and also in coordinating care with other health professionals so that gaps, redundancies, and errors are avoided. Teamwork it also involves shared accountability, shared problem solving, and shared decision making. The process of teamwork can occur in microsystems such as hospital units or with increasing complexity between organizations and communities. The following three competencies are representative for collaborative teamwork. Describe the process of team development and the roles and practices of effective teams. Engage other health professionals appropriate to the specific care situation in shared patient-centered problem solving. Apply leadership practices that support collaborative practice and team effectiveness. Links to theory. Theory of collaborative decision-making nursing practice. Kim's theory of collaborative decision-making in nursing practice offers a solid framework for the concept of collaboration. Kim developed her theory in the early 1980s following society's renewed interest in human rights and demand for informed consent. Kim recognized that many different types of nursing care decisions are made for patients that influence their health in various ways and that patients have the resources required to be active participants in making healthcare decisions affecting the outcomes of nursing care. Collaboration was defined as a process in which two or more individuals work together for the attainment of a goal, a process by which a joint influence on an action is produced. Kim's theoretical framework included the initial context of participant, both the patient and the nurse, and their accompanying role expectations and attitudes, knowledge, personal traits, and definition of the situation. This initial context then influenced the context of the situation, including organizational components of decision making and the nursing care decision type, such as immediate or long term effects. Next, the primary outcomes of the decision making process, the level of collaboration, and the nature of the decision were assessed. Kim stated that the collaborative decision making could be assessed on a continuum in which the lowest level of collaboration is expressed as a complete domination of decision making by the nurse, and the highest level of collaboration is expressed as an equally influencing joint decision making. Finally, the patient outcomes, the result of the primary outcomes, were determined: goal attainment, feelings of autonomy and control, satisfaction, health status, and recovery. Kim's model specifically addresses collaboration between the patient and the nurse, but could extend to collaboration with other family members or health professionals at the context of participant level, such as patient, caregiver, and nurse. Kim proposed several research questions to develop a knowledge base for the theory of collaboration in nursing. These questions continue to hold relevancy for collaboration with patients, nurses, and other health professionals. The following is a list of some of these questions. Are there opportunities for patients to collaborate in making nursing care decisions? Do nurses believe in the value of patients' collaboration in making nursing care decisions? What are the relationships between the patient's collaboration in making nursing care decisions and patient outcomes? What are the consequences to nurses of patients' collaborations in making nursing care decisions? Interprofessional Education Collaborative Model. The Interprofessional Education Collaborative developed a model that incorporates the four attributes of collaboration as previously described. The model was derived from social theories of learning and complexity theory. These theories recognize the social and experiential nature of interprofessional collaboration and the complex healthcare environment in which it occurs. The attributes of communication, roles and responsibilities, values, ethics, and teamwork and team-based practice are equally distributed in a fluid circle surrounded by patient and family-centered care. A final outer layer, including the importance of community and population-oriented care, is included. A straight arrow representing the learning continuum from pre-licensure through practice trajectory is situated at the bottom of the circle in Figure 46.2 on page 441 in Concepts. Context to nursing and healthcare. The implications for collaboration in the nursing profession are expansive. The American Nurses Association Code of Ethics for Nurses specifically addresses the importance of collaboration. The code addresses the complexity of healthcare delivery systems, requiring a multidisciplinary approach with the strong support and active participation of all health professionals. The code states that within the context of collaboration, nursing's unique contribution, scope of practice, and relationship with other health professionals needs to be clearly articulated, represented, and preserved. Nurses are encouraged to work together to ensure all relevant parties have a voice in informed decision-making and patient care issues. Nurses are also encouraged to promote collaborative planning to ensure the availability and accessibility of quality health services. The code also addresses the importance of intra-professional collaboration, that is, collaboration of practice nurses with educators, researchers, and administrators, because effective care is accomplished through the interdependence of nurses in differing roles. The Quality and Safety Education for Nurses, QSEN initiative, anticipates that collaboration will have a major impact on positive patient outcomes and improved quality of care. To date, conclusive results from research have been difficult to determine because of various definitions of collaboration, difficulty in measuring levels of collaboration, and small sample sizes. There are hundreds of published narratives and reports involving interprofessional collaboration, but only a few studies have evaluated the effects of practice-based interventions occurring as a result of interprofessional collaboration. Daily interprofessional rounds in inpatient medical wards in an acute care hospital had a positive impact on length of stay and total charges, but had no impact on length of stay in a community hospital telemetry ward. In another study, monthly multidisciplinary team meetings improved prescribing of psychotropic drugs for nursing home patients. Video conferencing compared to audio conferencing of multidisciplinary case conferences was found to decrease the number of case conferences per patient and to shorten the length of treatment in another study. Cheater and other colleagues reported that multidisciplinary meetings led by an external facilitator who used strategies to encourage collaborative working practices had teams using beneficial auditing that improved patient outcomes. Collaboration also has great potential to benefit nursing and other healthcare professionals. A strong teamwork culture has been found to promote job retention and to decrease resignation rates. Collaborative practice environments favorable to nursing have shown improved perceptions of registered nurse-physician communication, which was predictive of registered nurse job satisfaction. Other benefits that have been observed include improved communication skills, greater leader satisfaction, improved problem-solving skills, high levels of group cohesion, and increased satisfaction with patient care decisions. Collaboration has also been shown to benefit healthcare at the organizational level. A study led by Cohen compared traditional management of general medicine patients with nurse practitioner, hospitalist, multidisciplinary, team-based planning. Results showed that length of stay was reduced 5 versus 6 days, and profit to the hospital was higher, $1,591 versus $639, when multidisciplinary collaboration was used to manage patients. Interrelated concepts. Because there are many closely related concepts, collaboration is at times a fluid concept. Figure 46.3 on page 442 in Concepts presents these interrelationships. Professional identity involves use of nursing's full scope of knowledge, skills, and abilities while clearly articulating the role of nursing in collaboration and respecting the boundaries of diverse professions. Ethics involves nurses' ethical comportment when working in cooperation with various professions, patients, and families. Altruism, excellence, caring, respect, and accountability are important considerations. Communication is also an important ingredient of collaboration because individuals from diverse backgrounds and professions need openness and clear communication skills and strategies for collaboration to occur. The concept of care coordination is closely aligned and intertwined with collaboration. It is not possible to achieve highly efficient coordination of care without clearly effective collaboration among healthcare professionals and resources. Care coordination involves ensuring appropriate delivery of services and information, as well as coordination of resources to ensure optimal health and care across settings and time. These efforts occur while nurses, patients, and interprofessional teams collaborate to resolve a specific caregiving situation. The outcomes of collaboration include healthcare quality and safety. The healthcare quality is a desired outcome when collaboration occurs. Serious quality problems continue to plague the healthcare industry despite highly trained and technically skilled professionals. Error prevention, specifically reducing sentinel events and near miss events, requires a whole systems approach that seeks to understand the parts and their interactions as well as the broader concept in which they are embedded. Questions involving the expectations, assumptions, habits, behaviors, history, and tradition that influenced an adverse situation must be asked. A better understanding of the whole is needed for intelligent leadership and quality results in today's healthcare organizations. Collaboration with diverse professionals and patient-centeredness can make this happen. Safety is also a concept that is influenced by collaboration. Multiple threats to patient safety and errors occur at all levels of healthcare delivery. The Institute of Medicine, along with QSIN and Initiative, has changed from an emphasis on errors to widespread system change to ensure safety. A culture of safety is being promoted. The IOM encourages training programs for effective communication and collaboration, including transitions and handoffs. Collaboration is at the heart of resolving safety issues and creating a culture of safety in nursing and healthcare. Interrelated concepts. Because there are many closely related concepts, collaboration is at times a fluid concept. Figure 46.3 presents these interrelationships. Professional identity involves use of nursing's full scope of knowledge, skills, and abilities while clearly articulating the role of nursing in collaboration and respecting the boundaries of diverse professions. Ethics involves nurses' ethical comportment when working in cooperation with various professions, patients, and families. Altruism, excellence, caring, respect, and accountability are important considerations. Communication is also an important ingredient of collaboration because individuals from diverse backgrounds and professions need openness and clear communication skills and strategies for collaboration to occur. The concept of care coordination is closely aligned and intertwined with collaboration. It is not possible to achieve highly efficient coordination of care without clearly effective collaboration among healthcare professionals and resources. Care coordination involves ensuring appropriate delivery of services and information as well as coordination of resources to ensure optimal health and care across settings and time. These efforts occur while nurses, patients, and interprofessional teams collaborate to resolve a specific caregiving situation. The outcomes of collaboration include healthcare quality and safety. Healthcare quality is a desired outcome when collaboration occurs. Serious quality problems continue to plague the healthcare industry despite highly trained and technically skilled professionals. Error prevention, specifically reducing sentinel events and near miss events, requires a whole systems approach that seeks to understand the parts and their interactions as well as the broader context in which they are embedded. Questions involving the expectations, assumptions, habits, behaviors, history, and tradition that influenced an adverse situation must be asked. A better understanding of the whole is needed for intelligent leadership and quality results in today's healthcare organizations. Collaboration with diverse professionals and patient centeredness can make this happen. Safety is also a concept that is influenced by collaboration. Multiple threats to patient safety and errors occur at all levels of healthcare delivery. The Institute of Medicine, along with QSEN initiative, has changed from an emphasis on errors to widespread system change to ensure safety. A culture of safety is being promoted. The Institute of Medicine encourages training programs for effective communication and collaboration, including transitions and handoffs. Collaboration is at the heart of resolving safety issues and creating a culture of safety in nursing and healthcare. Clinical exemplars on page 442. The concept of collaboration with patients, nurses, and other professionals clearly has the potential to improve the safety and quality of healthcare delivery. Nurses must continue to find ways to clearly articulate the nursing component of healthcare in collaborative arenas. Involvement of nurses in the development of models of collaboration and development of collaborative interventions is needed. These collaborative strategies will continue to benefit patients, nursing, other professions, and healthcare organizations. There are many examples of collaboration within nursing and healthcare. These are presented as exemplars in box 46.1 using the categories previously discussed. Exemplars of collaboration. Nurse-patient collaboration. Collaboration on plan of care. Collaboration from time of assessment to discharge plan. Home care models. Community partnerships. Community-based participatory research. Nurse-nurse collaboration, quality improvement project, mentoring programs, dedicated information exchange, meetings, memos, email, shared governance, patient care handoff, student-nurse collaborative learning, interprofessional collaboration, rapid response teams, ethics committees, specialty care teams, patient rounding, team meetings for information exchange, quality improvement committee to discuss near-miss or sentinel events, patient care handoff, disaster preparedness teams, interprofessional education, interprofessional practice. Patient care handoffs. Handoffs using communication tools such as SBAR, situation, background assessment, and recommendation offer opportunity for collaboration in many situations. Collaborative handoffs can occur between nurses during shift change, between nurses when transferring patients to different units or facilities, between nurses and providers when receiving orders on patients, or between nurses and other healthcare workers when communicating critical information about patients. Many entities, such as the Joint Commission, the Institute for Health Improvement, and Nurses QSIN Initiative, recognize collaborative handoffs as an important strategy for the safety of patients. Interprofessional education. Interprofessional education. Participation in interprofessional education, IPE, events in educating nurses, medical students, pharmacy students, and many other healthcare professionals is an outcome goal in almost every healthcare college or university. Students are exposed to many different disciplines and their role in caring for patients. Students collaborate with each other on a variety of interprofessional projects, including quality and safety initiatives, community health projects, disaster preparedness, collaborative care in clinical settings, and many other interprofessional opportunities. IPE is recognized as an important educational component as students enter the workforce and collaborate for the best outcomes for patients, families, and communities. Community partnership. Healthcare professionals from many disciplines come together to work on a common initiative important to their community, such as a collaborative initiative on child abuse and neglect. In such an example, the collaborative collectively works on goals and strategies to ameliorate this identified community problem. Other examples of community collaboratives include homelessness, access to healthcare, nutrition in schools, and care of the elderly. The potential for positive healthcare outcomes for local, national, and international communities is endless, with individuals and communities working toward a common goal. Patient rounding. Patient rounding refers to the process of purposeful rounding to see each patient in each room or area on a regular basis. Patient rounding is often done by interprofessional teams to monitor progress and clearly communicate goals and a plan for each patient. Patient rounds are frequently mentioned as a means for collaboration, but reviews are mixed with regard to whether this is an effective strategy for collaboration. Patient rounding may also be done by nursing staff with the goal to check on patients on a predetermined basis, such as hourly, to determine if they have any needs, such as addressing pain level and assisting them with basic needs. Specialty care team. A specialty care team is an interprofessional team of healthcare professionals who work together around a specific type of patient or population need. Specialty team members represent various disciplines such as medicine, nursing, pharmacology, physical therapy, occupational therapy, nutrition, social work, etc., and contribute to the team by sharing their area of expertise, thus providing the best collective thinking for patient care. Examples of specialty care teams include pediatric, geriatric, pain, wound care, pulmonology, oncology, cardiac, and palliative care teams. Interrelated concepts. Collaboration and research. Health sciences research is moving away from the private investigator model to a collaborative model represented by interprofessional collaborators. Funding agencies are increasingly mandating collaboration as a requirement for grant funding. Exemplars, as mentioned earlier, nurse-patient collaboration, collaboration on plan of care, collaboration from time of assessment to discharge, home care models, community partnerships, community-based participatory research, nurse-nurse collaboration, quality improvement project, mentoring programs, dedication, information exchange, meetings, memos, emails, shared governance, patient care handoff, student-nurse collaborative learning, interprofessional collaboration, rapid response teams, ethics committees, specialty care teams, patient roundings, team meetings for information exchange, quality improvement committees to discuss near miss or sentinel events, patient care handoff, disaster preparedness teams, interprofessional education, interprofessional practice, and inter-organizational collaboration, regional, national, or international coalitions, and healthcare consortiums. Question: what concept involves ensuring appropriate delivery of services and information? Professionalism, ethics, communication, or care coordination? Question: what is the goal of interprofessional collaboration? Is it nurses develop nursing teams, physicians' communications with other physicians, formation of a partnership between a team of health providers and a patient, pooling of resources and information between organizations? And this is the end of the slideshow.